The World Health Organization is digging into the origins of COVID-19, but some health experts are worried that China may have influenced the results. KMBC9's Matt Pritchard is in Washington with the story.
Health officials in the United States want to read the report first to ensure that China didn't hold anything back from World Health scientists.
This is work in progress.
New findings from the World Health Organization.
We owe to the world to find or to get a better understanding of the origin of this virus.
A team of scientists working jointly with Chinese researchers concluded COVID-19 likely jumped from bats to another animal and then into humans. And that was one of 4 possibilities, along with the theory that a lab in Wuhan leaked the virus first.
It was ranked as the least likely, so to speak, of the 4 possible pathways.
But health experts in the U.S. are approaching the report with caution.
Until we know the answers to those questions, I think it's best that we view the report with some healthy skepticism.
Some are concerned Chinese officials may have held back critical data.
I want to read the report first and then get a feel for what they really had access to or did not have access to.
While those findings are reviewed, the COVID-19 response presses on. The U.S. is nearing 150 million shots administered, with other steps going into place, like an extension to the Paycheck Protection Program. Now, President Biden says it's a crucial bipartisan step.
Without somebody signing this bill today, there are hundreds of thousands of people who could lose their jobs and small and family businesses that might close forever.
With that extension, businesses now have until May 31st to apply for a Paycheck Protection Program loan. In Washington, I'm Matt Pritchard.
The joint World Health China report was conducted from January to February of this year. The chaplain of the Excelsior Springs Police Department has died of COVID-19. Pastor Larry Block has been with the department for 18 years. On the department's Facebook page, it says Block was, quote, a friend of every law enforcement member he met. And here's a look at where cases stand in our area. Over the last 2 weeks in Kansas, cases are down 6% and hospitalizations are down 25%. In Missouri, cases are up 16% and hospitalizations are down 7%. That's compared to 2 weeks ago. As more vaccines come online, we're learning very helpful tips on how to get one. KMBC9's investigative reporter Matt Fleener explains how you can sign up to get a vaccine quicker.
As more people are eligible for COVID vaccines, pharmacies like Hy-Vee and Walmart, CVS, they have appointments available throughout the day. But one secret we've learned, people are canceling appointments, making them more available.
It's pretty consistent all day long.
To see when those appointments are open, check out the Twitter account KC Vaccine Watch.
Everyone telling me that they got their appointments and they're very appreciative.
Peter Carnicelli has followed vaccine appointment trends for the past month. He created the KC Vaccine Watch Twitter account. It will automatically tweet as soon as vaccine appointments become available in Kansas City.
Sometimes it's a whole week of appointments, and then sometimes it's 1 or 2 that got canceled that they're putting back out there.
The Twitter account checks stores like Hy-Vee, Walmart, Walgreens, CVS, Hen House, and Price Choppers every single minute.
It runs 24 hours a day.
Speaking of, if you're a night owl, staying up late may pay off.
Between like midnight and 6 a.m., there's a whole lot of appointments being added and not much competition since most people are sleeping.
If you don't have Twitter, find somebody who does. Ask them to set up notifications for the KC Vaccine Watch Twitter account. That way they'll get instant notifications whenever appointments are available. Matt Fleener, KMBC9 News.
Now, the Twitter account's creator says that once most people have access to the vaccine, he'll likely close that account. Kansas is now in phase 5 of its vaccination plan. That means everyone over 16 who wants a vaccine is eligible to get one. Kansas is the 11th state to open vaccines up to the general population. Health Secretary Dr. Lee Norman says the state's on the right track, but needs to stay vigilant.
We need to double down on the challenges that were already existing, the hard-to-reach population, minority groups, and others that have a hard time accessing transportation. But I think that we're going to be fine.
The state had more than 158,000 doses of vaccines delivered just this week. Now, Missouri House lawmakers are rejecting efforts to pay for Medicaid expansion. KMBC9's political reporter Michael Mahoney has been watching the developments in Jefferson City. Michael?
Well, Kelly, last year, you might remember, 53% of Missouri voters approved a constitutional amendment to expand Medicaid for Missouri. Now, all day, House Republicans in Missouri and Jefferson City have been defeating Democratic efforts to put money into the state budget to pay for that. Now, it's about $1.6 billion in a $34 billion budget. It would expand Medicaid health care coverage to an additional 270,000 Missourians, mostly low-income folks. Republicans don't like it for many reasons. One of them, they say it's too expensive. Democrats say the federal government would pick up 90% of the cost. Kansas City's State Representative Ashley Bland Manlove says that rural Missourians would benefit from this.
Most of the poor are y'all's poor. Most of the poor in rural areas where y'all hospitals are shutting down.
This is the left's overindulgence in a Robin Hood complex of constantly trying to take from those who have earned to give away to those who have not.
Now, Democrats are probably going to sue the state if the money is not included in the state budget to expand Medicaid. Kelly?
39 states, including Washington, D.C., have adopted Medicaid expansion. 12 states, including Kansas, have not adopted the expansion. Missouri and Oklahoma have adopted it but not implemented the expansion. In Missouri, it is supposed to take effect July 1st.